quite a lot, and in strengthening and made progress in strengthening child protection systems through legal and policy adjustments. We still have some gaps which need to be looked at. The overview that we have is that child protection in Zimbabwe, whilst it is acknowledged that a lot of improvements have happened, we still have gaps such as violence against children and harmful practices, limited access to legal identity and birth registration. This was a very big topic yesterday. Thank you. Hello? Yes. Maybe that's too much. This was a very big topic yesterday, and I think today it continued. Child labor and economic vulnerability, children outside family care, and children on the move. I think we just spoke about that as well just now, and I think it's a question that was left hanging that we need to look at. Unequal access to justice and specialized services, social services workforce constraints, emerging digital and online protection for children, which we, I think, discussed again in detail yesterday. Just to give some kind of perspective, in terms of research and data that is publicly available, in terms of children experiencing multidimensional poverty in Zimbabwe, it's approximately 60% of children in Zimbabwe. They are experiencing multidimensional poverty. Children under 5 whose births are registered, just 57% of children under 5 have birth registration certificates, which is a big challenge, which we discussed yesterday as well. Then children aged between 1 and 14 that experience violent discipline. About 64% of children in Zimbabwe experience violent discipline. And then girls getting married before 18. 1 in 3 in Zimbabwe get married before 18. Then social protection expenditure. This is very critical, and I think this is the key discussion today, that hopefully at the end we can come up with some kind of resolutions or recommended resolutions to the authorities. Approximately 0.4 to 0.7% of GDP is focused on children in terms of our expenditures. Internationally or regionally, that ratio is 1.5% of GDP. So it just shows the gap that Zimbabwe still has to cover. And then social service workforce ratio. So social service workforce ratio to children, approximately 100,000 children per single social service provider. So that's a stretch. That ratio has to be reduced in order for it to be sustainable. So at the end of the day, I think what we want to do in the panel discussion is to provide the strategic platform for national discussion and high-level commitments to, we are not just going to be talking, hope we can have commitments to it. We want to strengthen alignment between policy commitments and financing decisions. We want to advocate for increased domestic financing and stronger expenditure visibility. We actually want to see the results of the expenditure on children protection. Explore innovative financing approaches and strategic partnerships for child protection. I'm sure we will be having people from the private sector contributing their views in terms of how private sector can partner with government. To strengthen advocacy for the investment case for the social service workforce as a critical pillar for sustainable child protection outcomes. I think we discussed yesterday why we should look at child expenditure as an investment. And then finally, mobilize practical commitments and recommendations to support implementation. As I said, I hope that we can come up with resolutions that are practical that we can implement. Allow me now, therefore, to call to the podium, having given that background, the following participants. First of all, for the Minister of Public Service, may I call Chief Director, Mr. Zimunga. Thank you, sir. May I know if there's anyone representing Reverend Damasani from the OPC? Okay, thank you. And then may I say, Honorable Mazungunye, Deputy Minister of Justice, Legal and Parliamentary Affairs. Mr. Takavarasha, Chief Director, Minister of Finance. My brother, Mr. Busisa Moy, I don't know if he has arrived. He sent me a message to say he's on his way. I'm not sure if he's here yet. I guess he will join when he arrives. That is representing private business or the private sector. And then for the ambassador of Sweden, Mr. Wanda Jekenu. Finally, for our co-hosts from UNICEF, Mr. Pepukai. Thank you very much. I was straight away going to giving them the floor to speak because I've painted the picture under which, or the context in which we will discuss. And I'll call upon Mr. Pepukai, first of all, to talk about UNICEF's views and the background and their recommendations to this whole discussion that we are having. Thank you.
Thank you. Good morning, everyone. Allow me to ride on the already established protocols. I'm just going to give a presentation on child protection financing in Zimbabwe. I have my colleagues who are online, whom the facilitator will introduce. The other one will bring perspective of South Africa. Then the other one will bring the regional and international perspective. So I'll speak on financing for child protection in Zimbabwe. As already introduced, my name is Pepukai Chore. I'm the Chief of Social Policy in UNICEF Zimbabwe Country Office. So as a background, we all know that we have 7.1 million children in Zimbabwe. Children, I mean those under 18, as in 2022 after the population and housing census. And those who are under 40 are nearly 40%, who are under 15, sorry. And this means that child protection becomes a national priority, which requires coordinated financing and government collaboration. The facilitator already spoke about these statistics, but it's suffice to also mention that drug abuse is now becoming rampant and our children are being affected. and this is linking to poor health, poor mental health, school dropouts, gender-based violence, and after the COVID-19, statistics are also showing that physical violence is on the increase, with online abuse risks that are increasing. Yesterday we spoke about online abuse risks. But let me also hasten to mention that child protection financing in Zimbabwe is dotted across several ministries. It's fragmented across about 6 or 7 ministries, and this division across multiple ministries may cause inefficiencies if it is not coordinated. It may also lead to coordination challenges. But the underlying thing is that funding can never be enough. It's insufficient given the scope of the problems that have been highlighted by the facilitator. And in terms of the operational budget, there are shortfalls, of course, and there's very limited budget visibility in terms of budget tracking, in terms of making sure that it reaches the child who is in need, the child in Binga, the child in Chikombedzi. So it's dotted across Ministry of Public Service, Labor and Social Welfare. We talk about case management, child protection services, Ministry of Health and Child Care in terms of child health and nutrition, Ministry of Primary and Secondary Education in terms of access to education, in terms of learner welfare, Ministry of Justice in terms of child-friendly justice and legal protection, and also even Ministry of Health, Ministry of Home Affairs. That's the registrar department in terms of birth registration and legal identity. So the government of Zimbabwe has done well in terms of allocating resources across these different ministries. I deliberately put the figures as they are in the budgets. And for the figures 2021 to 2024, they are actual figures. For 2026, this is what is in the budget. For 2025, this is what the 2026 budget provided in terms of what was allocated in 2025. So I deliberately left them in their currency because obviously you would want to compare ZW figures to ZIG figures to USD figures. But what's important for me in this presentation is just to show the percentage allocation to children versus the total budget. So what we have observed is that Ministry of Health obviously takes the largest share of that budget, and also followed by social assistance benefit in the Ministry of Public Service, Labor and Social Welfare. But there's a spike in allocation in 2024, and that spike is linked to currency transition from Zimbabwean dollar to ZIG, from bond notes to ZIG, and also the reclassification of some of the budget expenditures. It's not implying an increase in the real figures for 2024. So what it looked like is this. In 2021, we had 9.2% of our budget allocated to child protection activities across these different ministries that I've mentioned. That increased to 11.1 in 2022, then 11.2 in 2023. 2024 is where we had 32%, but that 32%, I hasten to mention that is because of the transition in terms of the currency that came in April 2024. 2025, we are at 13.5%, then 15% in 2026. Compare that to the Child Protection Fund that is largely funded by development partners. For 2016 to 2021, those were the figures. Then for 2022, those were the figures, bringing that total of 56.8. That is coming from development partners in terms of also the Child Protection Fund. But these figures need to be compared to an international benchmark. That's why we also have colleagues from the regional office and from South Africa to also give that international perspective. We have been allocating around 13.5 to 15% of our national budget to child protection activities, but countries with similar geographic profiles of 40 to 50% of children below the age of 18 typically allocate between 12 to 18%, which means we are within the benchmark. But what is important is the execution, and what is important is to ensure the efficiencies of those released resources. But so with that 15% broad child protection financing, I say it broad because some of the activities like birth registration, like allocation to health, a certain program within health, it's not specifically for children, but it's broad and it affects children. So that's the broad allocation to children. So in terms of the broad allocation to children, South Africa is spending around 17%, Kenya around 14%, Ghana around 12%, and Zambia around 17%. And this benchmark of 15% aligns with the National Development Strategy number 2. But we can use our National Action Plan to benchmark in terms of allocation. This is the budget for the NAP, which is coming to around 2.4 billion. So we can benchmark around the NAP because unlike health and education, where we have agreed international benchmarks of 15%, 20, for child protection, we don't have an international agreed benchmark. But the NAP can give us a costed, because the NAP costed action plan came as a result of careful costing, which tells us exactly how much resources that we need to achieve child protection outcomes. So we can use this as the basis to really determine the benchmark for allocating to child protection outcomes. So there are costed interventions in the NAP, so we can determine what is required per child in a particular year. If our allocations are less than what is in the NAP, then it means we are allocating less than what is ideal. Then we can also identify service delivery gaps. Then we increase from there and we aim to close those service delivery gaps. We can also make sure that we link our spending to results, as well as make sure that we set realistic annual budget increases. At present, the actual allocation to social protection per child is 17 cents in Zimbabwe, based on the 2017 figures that were calculated. So it's 17 cents per child for social protection per child. But child protection is broad. It covers health, it covers education, but I'm only talking about social protection. So we can, working from 17 cents, we can aim to increase that annually to probably successively reach maybe 50% or to $1 per child in terms of increasing the allocation. So the key message that is coming from this is that child protection is both morally important and economically important. We need to invest in our children because it is ethically essential and economically beneficial to do so. We are creating tomorrow's labor force. And insufficient protection spending is noted because of the increased needs for social protection across the various facets of the economy. But we have a basis, which is the National Action Plan for Children, to align stakeholders' interests and also mobilize resources to improve child protection nationwide. And we also need to make sure that we prioritize preventative action or preventative interventions, which are more cost-effective than crisis response after the harm has already occurred. We don't need to act after children are already engaged in drug abuse. We need to act before so that we prevent that. But we also agree that there is no universally accepted global benchmark which exists for child protection financing, but we can agree on a benchmark, for example, to say 15% of our budget should go to programs that affect children, but we also establish annual increases which are so visible in child protection spending to ensure that we sustain this investment and to use evidence-based costing via the National Action Plan, which is already costed, to improve financial planning and outcome. So we should agree as stakeholders that we need to allocate at least 15% of the national budget. That's a figure that I came up with looking at the global benchmarks and what we are currently allocating, and also the need to prioritize other spending in the economy. Because if we say 30%, then what it means is that we won't have any figures left for, or any money left for other programs like infrastructure development. I leave it here, Mr. Facilitator, and probably some of the issues coming from the regional and international comparisons can come from my colleagues online. Thank you.
Thank you. Thank you, Pepukai. I'm just thinking whether we should allow the online ones to speak immediately, because they will be aligned to following your speech, after which I think naturally we will go to the Minister of Finance. Before we go to the other ministries, then we can take it to the rest of the other plenary. So we can, if they are online, we can, who will start? I don't have the names. Okay, South Africa. I think you are muted, if you can hear us. He's talking, but we can't hear him. Technical. I can see him talking, but we can't hear him. Can you assist us, the technical bench there?
Can you hear me?
Yes, we can now. Thank you.
Oh, great stuff. Thank you so much. Let me start. Well, let me first of all recognize the Minister of Public Service, Labour and Social Welfare, Honorable Edgar Moyo, the Deputy Minister of Justice, Honorable Mozangunie, senior government officials, representatives of development partners, ladies and gentlemen. Big thank you also to Zimbabwe Country Office for inviting us, all protocols observed. I'm going to speak very quickly about the social protection sector in South Africa. How is it organized? How is it funded? Let me start my timer. I don't want to use more of your time because you are busy with very important discussions. So in South Africa, the most important part of social protection expenditure is centralized. This is the bulk of social assistance expenditure. The idea initially was that you do a subnational allocation, but because of the inefficiencies across provincial governments, it was decided that social assistance is so important, individuals receiving social grants, that it would make sense to actually have a national entity, the National Department of Social Development, and then supported by the entity within the National Department of Social Development, the South African Social Security Agency, SASSA, to actually do the work of actually making sure that beneficiaries are paid on time. The centralization effort has been massively successful. Many of the hiccups had been sorted out. You do hear now and then about maybe issues here and there, but by and large, the decision taken to centralize the provision of social assistance has been a huge success. The second approach involves making allocations to provincial governments, specifically for social welfare expenditure. And as my colleague just spoke now in the introduction, this concerns prevention and early intervention. There's some ECD-related expenditures, even though education basically takes the bulk of ECD. Combating the social ills in society, which is gangsterism, which is substance abuse, which is alcohol abuse, violence against children and women. Now, the mode of financing is slightly different. Provinces are given an allocation determined by a formula. That formula is based on the service needs within a particular province. So if you have more people in need in, let's say, Province A, let's say Eastern Cape, you are likely to get a bigger share of the national funding which is given to provincial governments. If you compare the social assistance budget to the social welfare expenditure budget, one is close to 85%, the other one is 15%, which means that the bulk of funding actually goes to social assistance or social grants, of which children basically also receive a sizable percentage. In fact, the child support grant consumes roughly about 1.3% of the country's GDP, which is quite a significant amount. And we are busy rolling out a new study with the Department of Social Development, and in that study we estimate that about 94% of children who should be receiving the child support grant are presently receiving the child support grant. And this suggests that the child support grant is arguably the most targeted child grant in the world, even if you look at the Brazilian numbers. So there's an odd 6% of children who should be in the system but are not yet in the system. And so UNICEF South Africa will work with our colleagues in the Department of Social Development, SASSA, Home Affairs, all these other different departments to make sure that those 6% of children are found and are given a grant. Because the evidence seems to say that if you receive a grant from an early age, the outcomes are far better than receiving a grant quite late. We do have a problem with 0 to 1 year old children. There's only a 50% take-up rate, and we are working furiously around the clock to establish what are the reasons for why very young children are basically not into the system. Only half of those children are into the system. Now, the third part of the financing modality is government relies quite a bit on non-profit organizations, especially at the provincial level. Non-profit organizations have a significant footprint, obviously at the local level, and it wouldn't make sense to take a relatively small department like Provincial Department of Social Development in Gauteng to do all the necessary work. So there would be straight transfers from the budget of, let's say, Provincial Department of Social Development in Gauteng to qualifying non-profit organizations who will then deliver services to children, to the elderly, to those with substance abuse problems, do prevention and early intervention programs. So that's broadly speaking how social protection is delivered in South Africa. NPOs, of course, have gone to court not so long ago, challenging the kinds of allocations they receive from the provincial departments of social development. They've been successful, but there's still a bit of a time lag between when the court judgments were delivered and the actual improvement in the position of financing for non-profit organizations. But this is clearly part of the national policy agenda. A policy is being developed. I think it's far and it's likely to be implemented fairly soon, where there's going to be some form of standardization about what non-profit organizations will actually receive across these different provinces. And as you will know, in South Africa, provincial governments are not subordinate to the national government because we have provincial legislatures and they take independent decisions about money which is transferred from the national level to the provincial level. Yes, there are national norms and standards. Yes, there are policy imperatives. But by and large, provincial legislatures and therefore the provincial cabinet, what we call the Provincial Executive Committee, are by and large responsible for how the monies are allocated at the provincial level. Now, just in terms of the social service professionals, obviously the budget of the Department of Social Development is dominated by actually giving out social grants. There's a lot of debate in the South African context whether that's the best way of actually alleviating poverty. The evidence seems to be kind of clear that if you put money into the hands of a human being, a responsible human being, they tend to make the best possible decisions about how to use that money, instead of the government prescribing how that money should be used. So in the South African context, there's no conditionality on how that money is actually utilized. There is some informal attempts, of course, to make sure that a child that goes to a school is in school, that particular child also participates in free healthcare services, etc., etc. So there's some level of coordination to make sure that a targeted child is actually getting all the other complementary services and so on. So I just want to say something about the financing itself. Children are fortunate in the sense that all the main important child social services, whether it's school nutrition program, whether it's receiving a social grant, whether it's free basic education, All of that basically falls under what the South African government calls the social wage, as opposed to the market wage or the labor wage. In other words, a group of individuals receive a transfer from the state and nothing is really expected in return from the beneficiary. You know, it's an unrequited transfer. And in terms of the social wage, child-specific expenditures are a significant component, whether it's the child support grant, whether it's the care dependency grant, whether it's the disability grant, et cetera, et cetera. There are significant expenses being laid on children in South Africa. And of course, as you know well, the problem is not so much the amount of money which is being allocated, but the efficiencies in key sectors. And here you're talking about basic education, you're talking about health, where there are deep discussions presently in the country about how best to utilize that money, which is made available from the national government. Provincial governments at this stage don't have independent taxation powers. Of course, there is a provision in law where they can kind of invoke a law, but then it has to be consistent with national provisions and so on and so on. And so far, they are collecting a fairly small percentage of their financing through vehicle licensing, casinos, gambling, and that sort of thing, etc., hospital fees, in public hospital fees collection, and so on and so on. So a fairly small part of their funding is actually coming from the provincial level itself, unlike the local government level where, of course, you have to pay for water, electricity, sanitation, you've got all these taxes on your property, and so on and so on. So local government, theoretically speaking, is in a better position than provinces, and there's been a call to consolidate the 9 provinces into maybe 5 or maybe into 4, or perhaps even collapse entirely the provincial level. None has actually come of those proposals. So the first thing to know is the social wage definitely benefit children. The second point around efficiency, SASSA is increasingly more efficient over the years. As I said, as part of the study, we've actually asked one fundamental question: why are some children entering into the system so late? And what we are finding out is caregivers have difficulty completing a normal application form. But once that application form is completed and it enters into the system, there's a small amount of time between a completed application and the child being listed as a beneficiary. So there's clear evidence from our side, which we will publish quite soon, that SASSA has actually upped its game in terms of making sure that kids who should be on the system are expeditiously entered into the system. And then the third point I want to make around the modalities, it's not enough to just give a child a grant. It's important that that very same child actually goes to basic education, goes to school. That same child participates in health services. That same child participates in prevention and early intervention program around substance abuse, anti-gangsterism, anti-violence, whatever you want to call it. And so a new policy is presently being discussed in National Cabinet with the support of the Department of Social Development to make sure that these services between social assistance, between receiving a grant and the other services are more complementary. In other words, the key fundamental question is, if you target a child, that child should not only benefit from a social grant, but should also benefit from all these other complementary services, therefore increasing the value of the social grant. Because sometimes you have a situation where one department affirms a child, targets that particular child for compensatory services or additional services, but another department doesn't classify the child in the same way. And in order to bring all these different services together, a new child policy is being developed that will make sure that these services are better stitched together, but more importantly, from a monitoring and evaluation point of view, the Minister of Social Development can go to Parliament and say, children who receive grants are doing better at school, or at least on the same level as children who are not receiving grants. They are healthier, or at least have the same levels of health as their non-grant receiving compatriots, etc., etc. So that then becomes part of the monitoring. So the Cash Plus agenda is certainly going to become more important because South Africa has throttled its public service, I think, for the last 10 to 15 years. Severe budgetary cuts have led to this increasing emphasis on effectiveness and efficiency. And one way for the social protection sector to show its effectiveness and efficiency is to link receiving a grant to better developmental outcomes, to better things, in the lives of children. And I think in this regard, although South Africa is providing evidence today and the region is providing evidence today, Zimbabwe itself has had a fantastic record in terms of many, many things that we would consider for granted these days.
Sorry, Russell. I have to disturb you.
Yeah.
I am giving you a minute to conclude. May I give you a minute to conclude?
Oh, no, yeah. So absolutely. The last point I wanted to make is that you yourself have a history of being quite effective in terms of developing a certain way. I'm thinking community extension workers and health. You never had a situation where somebody with a headache would present at let's say, a tertiary hospital. You had excellent facilities in terms of primary health care. And many of those older models, we think, which we just need to reignite in the South African context and elsewhere, which clearly used to be and was a significant success in your own country. So let me stop at that particular point. Thank you.
Thank you very much, Russell Wilderman, the Social Policy Manager, UNICEF South Africa, sharing his experiences. Many that I took note of, which I will not repeat, but I was caught by the fact that South Africa's distribution of these funds has become more efficient over the years. And I was just thinking of our BIM in Zimbabwe. Perhaps both the Minister of Finance and will take note of that and maybe comment on it when they come through. I will not waste more time. Let me go to Margaret Lewis Ivan in Kenya. She's the Social Policy Advisor for UNICEF at the UNICEF Center. Good morning. Habari za leo?
Good morning. Thank you very much to the honorable ministers, distinguished guests, colleagues, all protocols duly observed. Thank you for the opportunity and greetings from Nairobi. Just confirming you can see my slides and you're also able to see me. Hear me, I guess.
Yes, we can. Thank you.
Super. Okay, great. So to kind of start off by framing this, for me, this picture is really, really an important one. So this is looking across the region, across East and Southern Africa. And what it basically looks at is how is the child population going to grow in countries across the region over the next 80 years or so. You can see Zimbabwe is that yellow dot in the middle. What that tells us is that for the next 40 years, more than the next 40 years, the number of children in Zimbabwe are going to continue to grow, and the child population in 40 years' time will be around 20% bigger than it is today. So this has to be at the back of all of our minds as we are kind of thinking about what to do and how to create an environment conducive for the development of children. This whole conversation is about financing. I always find it really instructive to go back to Agenda 2040, the AU's Agenda 2040 plan, which is supposed to foster an Africa fit for children. And it explicitly says ministries and agencies responsible for planning and budgets are indispensable allies. We so often are kind of tempted to separate out what's happening with children and think our children are different from finance and budget, but actually they are really, really core and integral allies in helping us move forward this important agenda. What I'm going to do next is take a really big step back and just, you might have been talking about this over the last few days, but just kind of set the scene globally in terms of what's happening in financing around the world and on the continent. We know today, to give you a couple of facts outside of Zimbabwe, 3.4 billion people are living in countries that are spending more on debt interest payments than on health or education, so that we know that high cost of credit and high access to debt is constraining the amount of money that is available. We know that almost 20% of government revenue in sub-Saharan Africa is servicing is going by governments to service debt. And we also know that overseas development aid by donors is falling. It fell over 7% in 2024. All of these things mean that the amount of money that is available is unfortunately shrinking, not expanding, at least when we look at the external side. Now, the next slide is an optimistic one, I hope, right? But it's also a much bigger conversation than just around child protection. It's just to remind all of us that domestic resources, the money inside countries, is probably one of the biggest untapped opportunities, right? So on average at the moment, the amount of money that African countries are collecting in terms of tax as a ratio to GDP is around about 16%. On average, in Latin America, that's about 20%. In the OECD, that's 1/3. So there's potentially opportunity to raise more tax revenue, right? We know that across the continent, there have been a number of reforms, and those reforms have led to increases in tax revenue, 1.4 percentage points in increase in tax revenue. So there's work that can be done there. And we also know that there's a lot of money that is moving out of the continent in illicit ways. So there are ways to expand the bundle of resources. We just have to be aware of declining aid. We have to be aware of the pressures of debt. And we have to recognize that reforms are going to be required. So all of that is a framing piece, I guess. And where I really want to get to, Pepper Kai has given us a little bit of a sense of, in Zimbabwe, across sectors, what's being spent on children. Russell spent time talking about social protection. I really want to zone in because at UNICEF, in our global kind of practice, we've spent a little bit of time trying to understand if we really try to dig in to the money that can 100% be clearly allocated to child protection, right? So that's things like preventing violence against children, things like birth registration. If we really, really zone in on that, it's a tiny, tiny share of the total budget, right? So it only needs a tiny, tiny amount of this vast opportunity to get more revenue to really, really shift the needle. So I'm now going to move from my really high level step back, and I'm going to tell you a little bit about what we kind of found in our study when we looked specifically at child protection. So on average, right, across the region, across East and Southern Africa, you see on average around 8% of budgets are spent on health versus a 15% benchmark in the Abuja Declaration. You see around 9% is spent on social protection. That's kind of our cash transfers and our kind of, all the kind of payouts like pensions and so on, the grants that government is responsible for. Then we see education, that's getting a bigger share. That's around 15% on average. The global benchmark is 15 to 20%, but in this region, it's around about 15% on average that is being spent. I wish I could be in the room and ask for some numbers. I actually just put it up very briefly on the slide below. But when we took a look and tried to understand, when we try to identify what is actually being spent on core child protection activities, obviously children come into all of these. And as Russell says, it's so important that they're all connected. But if we look at those really, really core pieces that look at things like early child marriage, prevention of violence, providing safe schools, we find that only 0.2%, less than 1% of the government budget is actually going to those core child protection activities. And so, like I say, it's a very small amount. The flip side of that is that even small changes, even small increases in allocations can make quite a big difference to the capacity to deliver on core child protection programs. So I've put here a kind of sample of countries that we found information from. You'll see Zimbabwe is on the list. I didn't want to highlight it because the data is quite old. That in and of itself, I think, says something. I guess this is, for me, you can look at these numbers and they do mean something in the sense that they are kind of our best efforts to dig out numbers. But I guess what they mostly tell me is that it's really, really hard to identify these child protection activities in budgets. And when you can't identify something in a budget, it reduces the ability to hold key actors accountable for actually delivering on outcomes for children. Like I say, just a kind of sense of the very, very small amount, very small share of the budget in almost every country, less than 1%, when you exclude social assistance, when you exclude things like child grants and focus only on programs that are kind of core child protection, focused on prevention of violence and issues like that. I'll tell you a little bit about what I saw in Zimbabwe when we were doing this study. I say this with some humility because I sit here at my desk in Nairobi. I know I'm not in Harare, so I'm sure there are others in the room who are going to tell me that some of these observations are not entirely accurate. But like I say, when we look at core child protection spending, the numbers that we came, even though they were old in Zimbabwe, also less than 1%. We found interesting reference from ZimCard around an Auditor General report that said even of that small amount of money that was financed, the money ended up being diverted within the budget to different uses. So even though there was an allocation, it didn't always end up necessarily going to children. Other things were prioritized as execution moved on through the year. And the core issue for me, I'm going to sound like a stuck record, but hopefully you'll get the one message that I'm trying to say. The line of sight, where is the money actually sitting in the budget and where is it going, is really limited. And that's not a Zimbabwe only issue, that's a regional issue, that's a continental issue. In general, the definition of what constitutes child protection financing is fuzzy. Child protection financing, I think Peppa Kai even gave a nod to this, tends to be spread across multiple ministries. And so I would argue that of course we need to think about getting more money and more resources to children for these core activities. But even before that, possibly, we need to think about even better visibility. We need clear, identifiable budget lines, we need good expenditure tracking, and we need strong evidence. And so on that strong evidence point, let me quickly take a detour to your neighbor to the north. In Zambia, the government undertook a really thorough assessment of child protection spending. And it actually led to some kind of interesting thinking about how to reform things. So first of all, when they looked at what was being spent on what we would call broad child protection, which would include things like social assistance and grants and things of that nature, it looked like 17% of the budget was going to children. Not such a different number than what Peppa Kai is giving you in Zimbabwe. But when you actually boiled down to the core activities that were really supporting children and communities, supporting the social workers, supporting behavioral change, looking at things like gender-based violence, those core child protection services were only 0.6% of the budget. Very small share, again, less than 1%. And of those, there was a huge amount that was tied up in bursaries and transfers for orphans and vulnerable children. So again, money going to help children get to school, which of course is important, it's critical. But if you think that then only 1% of that 0.6% was then left to support kind of these things that keep children safe in their communities, you can see how very, very small the actual amount is. And so I guess one of the lessons that came out of this was that, of course, cash transfers, social assistance are a key way to reduce risk and improve outcomes for children, but they're not the same as fully funding the social service workforce, as fully funding justice or fully funding alternative care. And what we've seen in Zambia is that this kind of really strong analysis has helped build towards thinking about what key reforms can happen. We've also seen an increase in the allocations to the child protection budget. Again, not a big amount of money, but huge as a share. And we see there the government starting to talk about benchmarking per child spending to kind of ensure that there's a fair minimum. So again, to reinforce, tracking what is being spent is core. Good evidence is absolutely critical. I have a couple slides here, but a couple slides, maybe I'll skip the last year. I know we're running a little bit short on time.
Yes,
But one of the
was-
things that I
sorry.
often see when I move around countries in the region is that we all know more money needs to be
Margaret?
spent. But if I said to you
Sorry,
today,
Margaret?
I will wrap, sorry, yeah,
Yeah, you're right. You have to skip some slides. I'm sorry.
yeah, I'll make
you
this
have a
my last
minute.
slide
Thank you.
if that's okay.
That's fine. You have a minute.
Yeah. So I was just going to say, so I would add as a point moving forward, it's really important to know what things cost, and this is a cool part of financing. So if I came into the room today and said, we can give you $10 million extra, which I understand is around, I think, 0.1% or so of the Zimbabwean budget, if I'm not mistaken. What could you actually buy with that? And I'm not entirely sure what it could buy you in Zimbabwe. Like I say, I can show you in a number of other countries across the continent. It could, for example, in Zambia, fund a whole year for upgrading kind of the social service workforce. We have costing from South Africa that said it could help 20,000 high-risk adolescents. It could fund scaling up in Ghana of a whole community, 1/3 of scaling up a whole community level project. So my last closing slide, I guess, I'll leave it on this one, is just to say, knowing what you can buy with the money, the costing is so important. And then once you have that information, when you look at the kinds of examples that I've presented here, you can often see how small amounts of money can go really, really far in advancing some of those core child protection goals. I'll stop there. Thank you for your time. Looking forward to the rest of the session.
Thank you very much, Margaret. Yeah, again, pointedly, many issues that you have shared for us regionally, and in particular, you focused on Zambia. I think my key takeaway, which is part of the objectives that we have, you repeatedly talk about visibility of child protection spending. You even advocate for a line in our budget which talks specifically to child spending. Fortunately, we have both the Ministries of Finance and the Ministry of Public Service, Labor and Social Welfare, to take note of that. So we would like to hear when they come through. You also spoke about the opportunity to increase tax revenue collections. Zimbabwe is already at about 18%, Chief Director, if not 20, which is already like almost above the average of 16 you gave. So I guess what it then calls is what other alternatives outside government spending are there. I think South Africa spoke of non-profit organizations, but perhaps we will hear. Unfortunately, Mr. Moyo is not yet in. He's in a board meeting. He was hoping to finish it. Would have liked to hear what the private sector thinks in Zimbabwe. Having said that, I think I come back to the panel in front of us here. I think it's only appropriate that we start with the Minister of Finance. The challenge here, we know, is a limited public space, public finance space. We want visibility. There is social spending, which is acknowledged, but the specific expenditure on child protection, I guess, is what is being discussed here. We would like to hear what the ministry thinks and what you think will be the best way forward. Thank you. Chief Director.
Thank you. Thank you, moderator. Afternoon all. Looks like the more modern mics give way to the traditional mics. Anyway, thank you very much for listening to the three presentations from UNICEF colleagues from Zimbabwe, from South Africa, as well as from Kenya. From what I picked from the colleagues, there is need for, the last speaker from Kenya spoke of the need for visibility for spending on children in the national budget. From South Africa, the key takeaway was that there's need to always improve in terms of efficiency of distribution of the funding. And from Zimbabwe, Mr. Chiwore basically assured us that we're on the right track, we're within the regional average of between 15 to 18% of the budget spent on children. From the point of view of the Ministry of Finance, we are working with quite a number of MDAs, including the Ministry of Justice, the Ministry of Public Service, Labour and Social Welfare, the Ministry of Education, the Ministry of Health, also the Ministry of Women Affairs and Community, as well as the Ministry of Youth Development. In all those ministries, they've got programs, or at least some programs, which deal with support to children in terms of that protection. However, what we've noted, what we've noted from Treasury is that there are two key issues which determine whether we succeed, if at all. One of the key issues is that, okay, we might be distributing these funds to the various MDAs, but the onus is also on the MDAs to think holistically as one government, because the funding is all coming from one source. So obviously, let's try to maximize as much as possible the funding which should be allocated or dispersed or availed to the MDAs. Those three terms which I've mentioned speak of three different things. The allocation refers to the appropriation in the Blue Book via Parliament. Disbursement means the budget releases, and the availing actually means the cash at the end. So all those, there are also other dynamics involved in terms of how much actually reaches the ministry, which therefore means that whatever is actually availed to the ministry should be well utilized, should be targeted to the programs which they were initially set out to achieve. And there's also need for proper coordination among ministries so that we utilize the resources which are made available. Maybe the other context in which I wanted to maybe just highlight is that our budget also faces what we call fiscal realities, which is exogenous features which affect the actual cash which can be made available to the MDAs and also to the beneficiaries. These are, for example, climate shocks, global volatility. I am sure we're all listening to the news about what's happening in the Middle East. All that also has an impact on our planning from the Treasury perspective. To say, do you want to spend more without reserving anything for other eventualities or not? And there are also competing national priorities. From the Treasury perspective, we have got national events which we also support, from the Independence Day celebrations, the build up to that event. We also have other national events like Heroes and Defense Forces Day, the Youth Day, the Disability Day. All these are national programs which the various MDAs also participate in. So there is need for careful balancing of whatever resources are made available to the MDAs in order to achieve a little bit more with the few resources which are made available. I'm sure I've tried to give some proper context, moderator. Thank you.
Thank you, Chief Director. Of all the presenters, he has been the most to the point and briefest. Competing requirements against social spending, but however, it is being spent, but I think he touched a very important point, perhaps, which we should discuss as a group. Once the funds are allocated, they're then dispersed and they must be availed. I really caught that. So maybe they are being allocated, they are being dispersed, but not being availed. Perhaps we should investigate to find out what the challenges are. And he's calling on the MDS to not, what's happening, like something is dispersed for use in X and then it is used in Y. Perhaps this is what is happening. Also competing needs at the MDA levels. But however, I think as a house we will come up with recommendations and ways that finance can take back. Now, having heard from the Treasury, we can then go to the ministry responsible for these social issues. Can we, Honorable Deputy Minister, convince Treasury that we need a line in the budget which speaks specifically under the social protection line, specifically to children protection with in its various elements. And there's another angle that came from the UNICEF, that there's a kind of almost uncoordinated across 6 ministries responsibilities. How can we coordinate those so that we work with this whole of government thing, that there's a single point for all this responsibility, and then it's not spread along several ministries, and then I'm sure it's not in your privy. It might be at the pleasure of the president, but nevertheless, this is what the House is saying. Honorable Deputy Minister.
Thank you so much. Let me acknowledge our Minister in absentia and also fellow panelists here. I also take this opportunity to recognize senior government officials and relevant stakeholders who have convened here to discuss on matters regarding children's protection. I think at the moment, I felt it could have been prudent that the Minister of Finance would have ended after we have made our presentations, but because my presentation will also focus on some of the issues that as the Minister of Justice we do require that have gotten also a ripple effect or assistance to the Minister of Public Labor and Social Welfare. As has been said before, it is indeed tried that these matters are cross-cutting across all ministries. So we require a whole of government approach to solve these issues, children protection issues. And as the ministry, as you are well aware, we focus on development of the laws that govern or conduct or each and every situations that runs in the ministries. So today I'll be much focusing on how we are going to strengthen or investments or reforms that are urgently needed or required to strengthen our access to justice and also child-friendly justice services for the children. There was one speaker who was here in the panel in the morning, and they indicated that every dollar invested in the children will have a ripple return of about $13. It just clearly shows the importance of investing in the children protection rights. And as the Minister of Justice, Legal Parliamentary Affairs, as I have alluded to earlier on, we focus more on laws, crafting of laws that will support the social welfare services, the educational, mental health support, and the like. So there is so much need for intervention from the Ministry of Finance to ensure that we resource or resources are channeled towards what they are for their intended purposes. And on that note, we can take, for example, as the government, there's NDS2. This clearly, we have a pillar, governance pillar, which is part of the pillars of NDS2, which talks of governance and strengthening of institutions. This has to be strengthened. We can only do so, we can only achieve that if we resource well, they are resourced well, then we can proceed. And also, I will also proceed to focus on the issues that we really need as the Minister of Justice to ensure that we complement the efforts of Minister of Public Service, Labor and Social Welfare. We have the issue of diversion. It is also very critical, especially concerning juvenile offenders. When we talk of diversion, it is clear that the Constitution shows that incarceration must be an issue of last resort. And detention should be the last resort for juvenile offenders. And on that note, it is actually also expensive to put juveniles or to incarcerate juveniles. And on that, and also we thus have to ensure that we promote a situation whereby we exclude juveniles where they have a brush with the law. And we have to invest more in diversion programs. We have to invest more in restorative justice approaches, which will include counseling. We also include family conferencing, probation supervision, and also rehabilitation services. And if we manage to focus or to put our focus on such programs, we will definitely lower the cost and also achieve in our children protection agenda. And I wish to highlight that at the moment Zimbabwe has made progress in promoting diversion, although we have 1 center of diversion at Wawa, and we actually need to have more in all districts across the country, as scaling up diversion mechanism and also gradually moving away from institutionalizing and imprisoning children. This will actually have an effect. So if we fund more programs like these, it will also assist in complementing the efforts by the Minister of Public Service, Labor and Welfare. Also, we have to invest in child-friendly justice systems. It is very critical that we do so. And when we are dealing with the justice system institutions, especially for juveniles, we are talking of child-friendly courts, where we need to have more interview rooms for children, as currently there are no mechanisms which are specially designed for juveniles who have brushes with the law. And also specialized juvenile justice officers, they have to be trained, magistrates, prosecutors, police officers, probation officers, and also legal aid directors. They have to be trained so that they manage to fully acquaint themselves and also to deal with issues when children have brushes with the law. And in that regard, there is need for investment to strengthen access to justice, while at the same time ensuring compliance with national legislation and international standards. And also, child-friendly justice will not be achieved by laws alone, but by financing these institutions. So it's very critical that we adopt such practices. And also, there's another factor which we also have to strengthen, which is very critical for us in our justice, for us to have access to justice for all, and also for the children protection justice system. We have to strengthen our legal aid for children. As you are well aware that most children who have brushes with the law or who have conflict with the law, they usually come from vulnerable groups. And most of them, they can't afford legal representation. In as much as legal aid has been spread in all 10 provinces, which we also appreciate on part of the government, and also we have proceeded as the ministry to have about 8 districts where we have the legal aid directorate where it is present. So it is very critical that we spread it to reach as much districts as possible, as we will try to protect those vulnerables, and it will be in line with also SDGs, where we have to have access to justice for also the vulnerable groups. So these are other factors or other where we have to concentrate much more on our financing, and it also have an effect and also complementary role on the Ministry of Public Service, Labor and Social Welfare. Furthermore, we also have to expand the victim-friendly system. Currently, we have about 29 victim-friendly courts around the country that accommodates witnesses and survivors of sexual abuse. Most of these vulnerable witnesses are children. And the courts are very few and also vulnerable. They travel long distances to get justice. So on that note, resources are needed to further decentralize the victim-friendly courts and also capacitate them to ensure that we cover and protect the rights of the children. There are also interventions which are necessary also, which are very urgent to ensure that we have access to justice. The establishment of the National Sex Offenders Registry. This is also very critical. As the Minister of Justice, we also wish the Minister of Finance have took note of, so that when they do their budget, we also have to consider issues like these so as to complement the role of government in ensuring that we protect our children. And on the issue of National Sex Offenders Registry, the government is creating a centralized National Sex Offenders Registry. That's to modernize the justice system and combat sexual violence. At the moment, the country lacks an integrated system to track convicted sex offenders, hindering public safety and institutional vetting. And on that note, before a National Sex Offenders Registry can be built, the government must secure funding to finalize the legal and also operational framework. That is also critical, and another factor which is very necessary, which needs urgent attention. And also coming to the issue of the Anti-Domestic Violence Council, it also needs to be operationalized, and it means we should also channel resources towards operationalizing of the council. This is the council which is being created by the Domestic Violence Act, and the council will be there to keep records of domestic violence cases, and also it also has a mandate to ensure that we combat gender-based violence. And it will be having that role as their mandate to ensure that that is well kept and all records are well kept in the event that some of the perpetrators are then found in their way to the courts. We will be having records, and this will have also be a safety net and assist and complement on the Ministry of Public Service and Social Welfare. So operationalization of the council requires funding, and this will enable us to work together as whole of government approach. As has been said by a speaker previously, once we work together, once we approach these things as a whole of government approach, they will complement each other and will lessen even the burden on other ministries in their conduct of their operations. And the ministry is making significant strides in child protection through establishment of robust legal framework. Progress is evident in improved justice accessibility, specialized handling of children in conflict and those in contact with the law, and also enhanced rehabilitation systems. However, persistent funding constraints remain the primary barrier hindering full policy implementation and service delivery. So on that note, this will be directed to the Minister of Finance to ensure that we collaborate, and what has been disbursed has to be availed to ministries for proper functioning of our MDS. I thank you.
Thank you, Honorable Deputy Minister. I acknowledge that you would have wished finance to come in the last. We deliberately brought them first so that they can now listen. And this is why we had kept Minister of Public Service at the end, so that they consolidate everything into what we are going to be putting. So I think the key that I have taken from there is all these programs that require financing. And we all know the financing cannot come only from the government. So there'll be the role of partners. And who are the partners? The bilateral organizations, the private sector, other non-governmental organizations that can fund. So I think before we go on to that stage of potential funding partnerships, let's give the Office of the President an opportunity to speak. I think Dr. Reverend Damasani is being represented. Thank you.
Thank you, Chair. Honorable Minister, I recognize you. When we speak of financing of child protection, first and foremost, I want to state that the government of Zimbabwe is committed to financing child protection as a constitutional right. If you read Section 81 of our Constitution, it clearly states the rights of children. And more so, central to our development agenda is children. That's central to NDS1, to the Vision 2030. And this has been clearly articulated. When you saw the budget figures, how they've gradually been increased over the past 5 years, it really shows government commitment to funding child protection and childhood development. And then when we speak on this, we should look at issues of sustainability. I think it is very key. We could start programs, introduce programs, but what is important is sustainability. So what makes financing of early childhood development or child protection sustainable? It should be rooted on strong domestic funding and also national ownership. While development partners, they come in, they're very important, they play a critical role. As you saw the figures that development partners are contributing. They are there to complement government priorities and also to strengthen whatever government is doing. But really long-term sustainability is to progressive strengthen domestic funding. As His Excellency always says, we are the ones that should drive that. So when development partners come, they should help us to strengthen the system, to strengthen areas that will make the country on its own be able to fund those issues. Then secondly, we should prioritize preventative programming when it comes to child protection. Usually we say prevention is better than cure. When we invest in preventive programs, we save more from remedial action. You know, most of the social issues, to correct them, it's expensive. If you uphold our education policy, provide education to our children, it is better than trying to bring children who have failed and coming back. So we should invest in really preventive programs, as one of the speakers spoke on. Issues of supporting parents. That's a program on child protection that we can invest early than trying to correct. Yesterday, after Childline presented, and the Protas and the Minister of Information, I guess we are all saying, I need to know more about technology. So instead of, we can invest in that, teaching parents about these SAFIT issues than trying to correct when children have been abused, the cost will be less. So that priority on preventive measures is important. Then thirdly, I think financing should be looked, financing of child protection or child development should be looked holistically, not more of a social issue. It is an economical issue. By investing in programs that promote community empowerment or social development. I will give an example. An empowered community is better placed to protect children, to protect and help children. A Minister of Finance, I think it is spending more than 15% on children protection, if we look at the programs that they are providing. I'll give a practical example of the Presidential Borehole Scheme. It's fully funded by Treasury. They have the village-based units. Those can address nutritional issues within a community. It also can strengthen social protection systems for vulnerable members of community that are of working age but they don't have work. They can go there. That will then increase the earnings of that particular family, placing them in a better position to protect their children or to provide for their children. If our communities are developed, if we are to really push for long-term sustainability of child protection, let's empower our communities. Let's invest in programs that will reduce poverty and inequality, a long-term one. I want to say this. How best do I say it without chasing our investors? When the parents are well-to-do economically, if we are to achieve Vision 2030, where we have minimum yearly income 3,000, do we need BIM? If you are earning 3,000, you'll be able to pay for your child fees. So I was saying in long term, let's invest in programs that will push for community empowerment, community development. It will help reduce the other cost. And lastly, before the chairman takes the mic, the issue of transparency in terms of budgeting. I don't know, CD finance maybe is too much. If we have sectorial planning and budgeting, we know as a sector how much are we allocated. Because if you want to say we want 50%, who will build the infrastructure? Where would we get the money? But if we know this is how much we have as a country, Minister of Education, you are getting here. Public service, you are getting here, so that we all plan together. It will force us to plan, to budget, to implement, to evaluate together, and build and protect our children. I thank you, sir.
Thank you very much. Prevention is better than cure. And that can be achieved through community capacitation. I mean, capacitating the environment in which these kids are, starting from the parents themselves to the bigger community. So when all is said and done, it all comes back to financing all these things that we're talking about. We know that, okay, the primary financer or the primary funder is the government, but let's hear from development partners, from private sector, from any other potential sources. So I would like to call upon the Swedish Embassy, Mr. Wanda Jekenyu. Jeke, forgive me if I pronounce it the wrong way, to speak on behalf of perhaps development partners. Thank you.
Thank you very much. It's Jekemu. but we are not very far from it. Let me acknowledge the presence of the ministers here present and several government officials that are here. Now, representing Embassy of Sweden, we have had quite a number of lessons learned in supporting child protection in the country for over 15 years. One of the things that we have learned through the 15 years that we have been supporting child protection is the solid foundation in which the program has been grounded. You'll all agree with me that the partnership that we've had between government, UNICEF, and civil society and CBOs is quite commendable. It is this partnership that has made the program to be so smooth and to get the results that we are seeing today. One other thing that we have learned over the years is that systems, not just projects, create sustainability. So around the issues of sustainability, we have seen that the biggest gains into this program was strengthening national structures, strengthening the social work cadres, issues around strengthening CCWs, the case management, the child protection management information system, and community-based mechanisms. These systems, we are so sure that they will create the sustainability of the program beyond the funding that we have been giving. We have also learned that local ownership drives results. I think the President's office has actually highlighted that, that projects need to be owned by the locals. We have realized that when key stakeholders, government, traditional leaders, and other stakeholders participate in the design of a program, definitely monitoring of that program is quite easier, because everybody else in the program will have interest, keen interest on how the program is faring. So we believe that Sweden's approach of backing government leadership with the UNICEF funding CSOs for grassroots delivery helped avoid parallel structures. So that alone is quite key and important. The presentation from Margaret spoke of data, and we believe that data and evidence, keep it honest, figures don't lie. UNICEF and government approach of evidence-based programming through surveys, audits, and violence against children studies made it possible to see what was working in the program and made it possible to tweak the program so that they speak to realities on the ground. The other thing that we also learned through the support is issues around integration. We noted that child protection does not work in isolation. Child protection links directly to poverty, to education, to health, and to climate shocks. So the partnerships that we have seen over the years that worked best were the ones that connected social protection, cash transfers, and parenting programs instead of treating protection in isolation. We have had quite some number of visits in Chikombedzi, in Binga, in Epworth, and other places. We could see this interplay of partnership and integration of the program that resulted in a lot of positive outputs of the program. Let me talk also briefly about opportunities to sustain gains and catalyze broader investment. I think also Margaret, were in a presentation, as well as the President's office in a presentation as well, they have highlighted the issue of domestic resource mobilization. Let me not talk about that. I think that has been very well presented around domestic resource mobilization. What I think maybe I might need to talk about is the issue of untapped funding from the local companies, one would say. We have at one time had a meeting at the embassy with a number of local companies. But what we realized from these companies that the requests that they've been getting from different CSOs were more of one-off events. They testified that they never had requests of programs, 3-year programs, 2-year programs. So that's one avenue that might need to be tapped. That instead of approaching these companies with one-off interventions, try to present to them programs which are more than 1 year. There's also the issue of coalitions beyond the traditional donors. I think that one also has been very well spoken about. And the issue of roping in private sector that I've just been talking about, that needs to be also looked into. A colleague in the room on the first day spoke about diaspora networks, also that needs to be tapped in. And I know that there are quite a lot of resources in the faith-based organizations. And that is also a resource that is not very much tapped. It looked like most church organizations, faith-based organizations, deal with their child protection issues in isolation. So it is also one resource that we can be able to tap on as well. We have realized that investing in the workforce, issues around supporting social workers and the frontline professionals, CCWs, are at the heart of the effectiveness of child protection response. Investing in this workforce is among the most impactful investments that can be made, because every reform ultimately depends on the capacity of the trained professionals to reach and support vulnerable children and families. I think that is very key as well, and it has been overemphasized during the past 2 days that there's need to invest in the workforce. As we invest in the workforce, there's also need to look into retention schemes, issues around mental health support for the frontline workers, and also create better career pathways so that we retain our personnel. Issues around technology for prevention and reporting is also very key that we also realized. Currently, we have seen that management and data dashboards have been quite good and are showing promise. So we are proposing that scaling these up with the strong data protection can make the system faster and more accountable. Then we have of late seen that there is a number of risks that are emerging across the world. Online exploitation. I think the regulator yesterday touched on a number of issues that were surprising to most of us. So it is also very important for us or for the program to start investing in online exploitation, investing in climate displacement, issues around migration, and the geopolitics that we have currently, that is shifting. So we see that the risk landscape is actually shifting. So it is also important that we invest in the studies that would at least highlight the upcoming investments, highlighting future risks, so that our future investments should fund research and pilot programs that anticipate these and not just respond to current patterns that we have. Let me lastly talk about what would make partnerships broader and more catalytic. To the donor community, I think it is also important for the donors to support multi-year flexible funding so that government CSOs can plan beyond 3 to 5 year cycles. And also they should be left to have the funding flexible rather than earmarking funding, which will pose problems if the earmarked fund is not speaking to what is reality on the ground. There's also issues around South learning. I think we have seen that happening today, these 3-4 days, connecting Zimbabwe's experience with other countries. We have had Zambian experience, we have had Kenyan experience, we have had a South African experience. So I think these are quite important and should be continuously allowed to continue. And at the core and principle, of this child protection should be the child participation. We also encourage that child participation be at the core and not as an add-on or a tick-the-box type of intervention. We need children's voices in policy design and keep that would assist in keeping the program relevant. So in conclusion, the foundation Sweden helped to build together with UNICEF and government is a functional policy framework, trained workforce, and the community structures. These are the assets that we need to protect. The opportunity now is to move from donor-dependent programming, which has been highlighted by the President's office as well, to a nationally owned multi-stakeholder system that attracts investments because it delivers measurable outcomes for children. Lastly, conferences like this, ladies and gentlemen, are important. They bring together all stakeholders that work for the betterment of the child. If it is my wish, I would definitely make this an annual event which would allow this cross-pollination of ideas to take place. They are quite important and key to the betterment of the welfare of the child. I thank you.
Thank you, Mr. Jekenya. For me, I'm very interested in the untapped funding. I think instead of saying local companies, I'm calling it local sources so that we can broaden it. And he gave a rundown of potential. What touched me are a lot of things that we take I think for granted, which are potential financing sources for this problem or challenge that we have. Faith-based organizations. I think that is a big one. And if we can harness and work together with such an organization, just taking an example, perhaps we will come to some kind of level of achievement, because we've already seen that the government, we have acknowledged in all these things that the discussions we have had, that the government itself is already doing quite a lot. I think we got a ratio of about 15%, which is actually seen to be maybe above regional partners, but the weakness being that we don't see that line which says child protection. So before I've decided that I will come back to finance to conclude. I wanted to conclude with the Minister of Public Service as the host, as the owner of this project, for you to now perhaps wrap up everything, all suggestions that have been concluded, and perhaps to begin for us to then discuss sort of resolutions or way forward that the ministry takes back. Chief Director Zimunga, thank you.
Thank you very much, moderator, for this opportunity. I won't take much of your time because I'm standing between people's lunch and this session. The discussion here is very important as to why we need to protect children and why we need to invest more in child protection and prioritize funding. I think these are the sentiments which have been echoed from the first speaker until the last speaker. There's a demographic reality which is in this country. According to census, children under the age of 18 years record a staggering of 40% of the Zimbabwe's national population. And what does that mean? It means that the welfare of our children is the welfare of nearly half of our population as a nation. We are talking about children. And the document that is going to be launched tomorrow talks about children. The earlier national action plans were talking of orphans and vulnerable children. National Action Plan for Orphans and Vulnerable Children, 1, 2, 3. But now we said we are neglecting or ignoring other children. Why are we focusing on vulnerable children? Let's focus on all the children. And that's why we have the National Action Plan for Children. But here's another reality. A critical 61% of these children are from income poor, and 36% are food poor. And this calls for action. These multidimensional deprivations are significantly more severe in rural areas and are continuously compounded by recurrent climatic shocks, such as the 2024 El Nino-induced drought, and weather experts have also predicted some rainfall disparities in the coming season, which means that we need more resources, more funds, more action to protect these children from climatic shocks. Yesterday, there was this discussion on the online policy by the Minister of ICT, and this is the emerging vulnerability which is confronting our children. And not only that, because these children are exposed to online vulnerabilities and attacks, but because of technological advancement, we need to discuss and think about how we are parenting our children. Many of us here, we are employed, ministers, ambassadors, and so forth. We spend the greater part of the day in meetings. And when we drive home, you look at your phone, there are 146 messages from the community WhatsApp group. There are 600 messages from the church group where you are a treasurer and you want to read all the messages. Who is taking care of the children? You sit at the corner, holding onto your phone, carrying the backlog messages, and the father is also seated there, who is with the children. And it's high time that we need to discuss how we can better parent our children in the face of technological advancement. Climate change, I've talked about it. I've also talked about migration-related shocks. Right now, some of our children are coming from South Africa and other countries, joining others. How best can we protect those children? We also have a constitutional and international mandate to protect children, Section 81 of the Constitution and the Children's Act, placing strict legal obligations upon the state to ensure that every child's best interests are paramount, as well as that we have obligations related to the UNCRC and the African Charter. But let me also talk of our commitment to the nation under Vision 2030 and the NDS2, where we envision ourselves as an empowered and prosperous upper middle income society. Let's think of this empowerment. How do you view child protection by 2030? She talked about empowering communities. Let's also empower these communities how to take care of their children. Not only financially. I know when many people think about an upper middle income society, you're thinking of your pocket being fattened. You have more people who have money and so forth. But what about these children? And how are we going to measure our success? Are we going to measure our success by the number of children that have gone through the courts, who are in conflict and contact with the law? And what does more numbers mean by 2030? Are we talking of many children who are on social cash transfers? To me, that's not it. We must talk of a reduction in the number of people, the number of families who are dependent on state support, including children. Are we envisioning a situation whereby millions and millions of children will be under education support. That's not it. We must have less numbers to show that we are empowered. So we must invest in parenting. And the Children's Act places emphasis on parenting and responsive caregiving, implementation of laws, and response and prevention. Zimbabwe has a number of laws and it's progressed very much in terms of aligning the legal framework to the Constitution. And the NAP 4, which we are witnessing tomorrow, is the testament, amendment of the Children's Act, Marriage Act, criminal law alignment, and many more. But what that mean to us in terms of financing? We need resources to implement these laws. If we fail to get resources, whether human resources, financial resources, these laws will result as white elephants. And you don't want that. And this calls for more financing for child protection issues. The cycle of vulnerability is also very interesting. Chronic poverty and climate-induced agricultural failures drive immediate household economic stress. According to the World Bank, the financial strain forces vulnerable families to pull children out of school, leading directly to a correlated spike of dropouts, child labor, and the transactional surfeit. These are the challenges that we have. The rural-urban disparities, we must also take note of it. Many people think that we have poor people who are vulnerable in rural areas, not knowing that in urban areas there is an emerging trend of vulnerability, which we must also focus on. I want to applaud the Minister of Finance because the trajectory that we have moved for the past 5 years is commendable. Because non-contributory social protection grew from 4.3% of the national budget in 2023 to 4.5% in 2024. Again, in 2025, we had 6.9% for non-contributory social protection. These are social safety nets. Let's give them a round of applause. Despite this, we have a liquidity challenge, which I think the Ministry of Finance, and I'm sure they are addressing it, macro fiscal constraints, creating a mismatch between approved appropriations and actual cash releases. And I know the Chief Director, Ms. Sita Kavarasha, talks about it, and it's something that they are addressing it even now this year. There's been an improvement during the second quarter of the year in terms of financial releases. Now, tomorrow we are going to make a commitment through the National Action Plan for Children. And we need to secure a long-term future funding for the NAP. The funding we require for the next 5 years under the National Action Plan is 2.4 billion over the next 5 years. And this does not only mean funds coming to the required by the Minister of Public Service, Labor and Social Welfare, but she talked of a whole of government approach. Every speaker here talked of a whole of government and whole of society approach. This is the money that we require to implement the NAP across all sectors: justice, health, education, social protection, and coordination. So we need to bridge the cash release gap, and this requires us to design alternative, innovative, and diversified funding mechanisms. Let me at last talk of the priorities for investment. Number one is we must invest in data and monitoring and evaluation. Currently, the government has put in place an architecture to ensure that we have monitoring and evaluation, we have data analysis in each and every MDA. And let me call upon and emphasize that we need indicators that speaks to child protection. Therefore, we must accelerate the transition away from administrative paper trails, which currently overwhelm every institution and paralyze national evaluations. Let's expand digital registries, like we have the Zimbabwe Social Registry, which are working on, the Minister of Justice, the Justice Management Information System, by MIS, is all that there. And the health, they have an MIS, the civil registry, you have a digital platform. Let's ensure that these platforms, they are interoperable, they speak to each other, so that we have data that speaks to what we are doing. The other aspect is on pro-shock responsive financing. Rather than operating reactively or waiting for slow legislation or international donor processes following an emergence, Zimbabwe is moving towards a proactive shock responsive. We have come up with our shock responsive roadmap, where we want to ensure that all the policies relating to social protection and child protection are shock responsive. We want to be ready when emergencies occur. And all our financing architecture should ensure that we can integrate, we can respond to emergencies when they occur. So by embedding automated, pre-financed allocation triggers, we must possess the fiscal capability to release immediate safety nets in the case of emergencies. That is to drought, other disasters, COVID-19. When COVID-19 affected our country, we were caught unaware, and many people were now unable to meet their basic needs. We didn't have a database. We didn't have the fund which was earmarked for shock responsive. But what we are saying is, our funds should be shock responsive. We must not think of how can we assist our children in emergencies, but we must utilize existing funding models to assist our children. So this model directly, we benchmarked it with successive frameworks like the Kenya Hunger Safety Net programs. I think we had a presentation from a colleague from Nairobi on how we can finance our child protection. So we can think of other funding modalities apart from the fiscus. The Ministry of Climate Change, Environment is the Green Climate Financing Framework. We also want child protection, children to benefit from that fund. I know a number of organizations have applied for that, and many organizations and institutions are also benefiting from it. Public-private partnerships and local authorities. There's good work that has been done by local authorities. I saw some of them here, and the Angel of Hope, under the guidance of our First Lady, Dr. Auxilia Mnangagwa, where we had to transform an institution into a state-of-the-art children's home in Shirezi. So this is something that we can think of. How can local authorities also chip in to assist in child protection? And this institution houses children living and working in the streets. And there have been success stories. One of the children, some of the children have passed their advanced level studies and they're going to universities and so forth. So we can also expand on how best we can work with local authorities. Catastrophic bonds or insurance like the Africa Risk Capacity is also another model. Community contribution is also another model that we can employ. Ladies and gentlemen, this marks the end of my discussion, but before I conclude and hand over to the moderator, I want us to take note of that. It is not a matter of resources limiting our decisions, wherever we are. But it is our decisions limiting the use of resources. We have resources, few or little as they may be. Let's make sound decisions. How do you make decisions on the resources allocated to you by Treasury? Matter, not the amount of resources that you are getting. Thank you very much.
Thank you very much, Chief Director Zimunga. Long-term commitment on child protection, and we are launching it tomorrow. And it is those priorities that were listed. But I like the concluding remarks, that what limits us are not the resources, but our decisions. I think I concur with that. It's how perhaps we are saying, in my words, our priorities. So we are deciding on other priorities using those same resources. Thank you very much. This is the last phase of our being in front of you, so I will just give each panelist, of course, concluding with finance this time, a minute to give us closing remarks, starting from my right.
Thank you very much. So what's clearly coming out from us is that on paper we have, and broadly, we are allocating resources towards child protection. But we have spoken about fragmentation, which now calls for visibility, which now calls for budget credibility, which now calls for evidence and costing, coordination, and complementarity to make sure that we focus on the child both for all protection issues, be it education, be it health, be it protection from violence and everything. Once we do that, then we are molding a child. And we see so many opportunities to increase domestic financing for children. We have done AIDS levy as a domestic resource allocation. We can do that. There are also so many opportunities to broaden the child protection fund. There are so many opportunities to integrate fiscal space in sector-wide approaches through the child protection fund, through other opportunities like matching contribution, where we put $1, development partners also put something, rather than relying on development partners. Thank you.
Thank you. My last word is prevention is better than cure. So let's invest on preventive programming and work together. Let's plan together. The resources, the few resources that are there, they can go a long way if we work as a whole government, as a whole society. I thank you.
Thank you. My last word is, it takes a village to raise a child. It takes a community to raise a child. Let's work together. Let's coordinate. The church, business people, the academia, the parliamentarians, professionals, let's work together to protect our children. Our children, by virtue of their physical and emotional immaturity, they need our protection. Thank you.
Thank you so much. My last words would be investing in our children and also investing in our children's protection is investing in the future. So we have to protect our future. We have to protect our children as they are the future human capital, which will have a positive impact in our country and also for national development. So working in silos will not take us anywhere. We have to work as a whole, as a one unit, because when we are united, we stand a chance to conquer and to succeed in everything that we do. I thank you.
Thank you. My last word is child protection is not a cost. It is an investment. It is smart economics, sound public policy, and above all, the right thing to do. Thank you.
Thank you, moderator. My last words is basically also to thank colleagues. I was taking copious notes from you. I learned quite a lot as well from all the colleagues in this panel. But one thing which struck me is that we need to build on our resilience as Zimbabwe. We are well known globally for being resilient people. Unfortunately, from where we are, if you don't have the outward perspective, you would think really Zimbabweans are not that strong, but we are strong. But we also need to then say, okay, if we are strong and we are resilient, let's reduce those indicators of vulnerabilities in our society. We shouldn't applaud the number of vulnerable people who are supporting. We should actually show that there's been a change between one intervention and the other. Collectively, as all the MDAs who are being supported from the fiscus, as well as the development partners support as well. I also liked one thing from my colleague on my left. He indicated that it's better to improve systems than to always think of the dollar sign, how much have I received? Let's improve the system so that as more and more money gets distributed, it's effectively utilized and is targeted to where it's supposed to achieve most. On that one, I thank you, moderator. But I also wanted to say something one more time, sorry. Government is actually empowering the communities. We've got community development funds. We're also empowering the communities via the banks, two banks which we are supporting. That is the Women's Bank as well as the Empower Bank. So we'll need to actually improve in terms of capacity of these two banks so that they reach as wide a spectrum as possible and they are effectively utilized, not as funding for frivolous activities, but for empowering the individuals who will then in turn know that they are moving from one level to another, from poverty to resilience to being able to look after their own endeavors. I thank you, sir.
Thank you. I would like to thank all my panelists and to thank the Director of Ceremonies for the opportunity and for not even signaling to us that we have extended our time. It shows that we didn't. Thank you very much. I can now release my panelists and enjoy. I'm sure we give the mic back to the Director of Ceremonies.
Thank you, Mr. Ogaro. I think you did not see this now. It was coming in different forums. All right, just a round of applause to them again as they take their seats. Oh, a great deal that has been spoken about, which we will not dilute by going into detail around, but most critically, knowing that we all need to play our part in terms of financing child protection here in Zimbabwe. The issue of domestic financing, very key, ensuring that we use the resources that we have. Many or little, it's still okay. We should be able to find a solution to ultimately protect all our children, and taking a whole community approach. That means all of us have a responsibility, or all of us, we have a responsibility to play our part. So ladies and gentlemen, this brings us to the end of our day. That is the first part of the morning. Now going a bit into the afternoon. And I'm sure now we would like to get our tummies filled, so I will give a few announcements. For lunch, we will be using the same spot that we were yesterday, that is in Hall 1. And there is also a designated VIP side bit for those that are having lunch in Hall 1. However, for the VVIPs that I indicated, that would be representative for the Honorable Minister, the Deputy Minister, Permanent Secretary, Registrar General, members of UNICEF and MCOS, you will be escorted to where you are going to have your lunch. I think, yes, you can follow Mr. Magoro there. Also, to let everyone know, remember we have breakout sessions that are supposed to take place after lunch. So, the first breakout sessions, we are hoping that lunch, if we can ask you to have your lunch in 30 minutes so that we have our breakaway sessions starting at exactly 2:30. And this will be for an hour. That is the first session of our breakaway sessions. As you can see, they have now been bunched together. And we can take a 15-minute break before we start the second set of the breakaway sessions. The breakaway sessions, we have the one on child-friendly justice, birth registration and legal identities, alternative care, and child labor. Then we do have another set of breakaway sessions, which is the one on children on the move, adolescent pregnancies, drug and substance abuse, and HIV-sensitive case management. In between, we are also going to have field visits. So there are those that have been allocated spaces in buses where the field visits are going to take place. So you will be notified on where exactly you're going. However, the buses have been clearly labeled outside for those that would want to conduct or those that would want to go for those field visits. Please kindly ensure that you also talk to our ushers who will be outside and manning those buses. Otherwise, ladies and gentlemen, thank you once more. We will not be congregating here again after the breakaway session. We can all take leave. However, may I also ask that for tomorrow's program, may we all be seated here by 8:30 sharp. For tomorrow's program, may we all be seated here by 8:30 sharp. There's also an announcement around parking. I know that we've had the privilege of parking right in front there, but tomorrow there will be alternative parking that is specially reserved for our guest of honor and the VVIPs. That is for tomorrow. So you will be directed to where you're going to be parking. Please work well with the ushers who will be outside. Otherwise, let us all go and enjoy the lunch. And can I ask that first, can we get our VVIPs out before the rest of us follow? Meal tickets are being given at the serving points, so please just make your way to the serving points. That is where we're getting our meal tickets. Thank you.